Thank you so much, Camille, and I am delighted to be with you this afternoon. The work you do is so exciting, and it is at the core of what drives me and is important to me. And I don't typically speak from prepared notes because I usually have a few things I want to say, and I random, and my staff always gets nervous, but I never get into trouble. But today I do have there are some things I want to say, and I am going to speak from some prepared notes for just a minute because we are so eager and honored to have Dr. Lee with us. I want to get right to him. But this is, I know, an emotional time for a lot of us. And as the sun comes up and we keep going, we reflect on the work we've done and the work that we have ahead. So I honestly didn't trust myself to go very far off the script because I'm still a little raw, and you all mean so much to me in the work that you're doing. I want to get right to what we are about today. At your first annual summit, I stood on this same stage with my partners at First Five, George Halverson and Superintendent Tom Torlickson. We made a promise that under our leadership, our agencies would forge an even closer partnership and align our efforts on behalf of California's children and families. As we know, the people of our respective agencies serve often are the same people. They're accessing an array of programs that cut across our departments, and they depend on our services for their crucial social and health safety net. We've learned from decades of early brain research that brain development during a child's earliest months and years forms the foundation for everything they will ever learn. This is the same foundational science all of our work is based on, which is why it's imperative that we work together from this shared understanding. At last year's summit, we committed, the three of us, to partnering on three core efforts. First, and simply put, we promised to work together. Since we made that promise, together with our leadership teams, we've forged a tri-agency working team we've dubbed the Talk, Read, Sing Coalition. Our teams meet on a regular basis, and they continue to move the ball forward on all of our cross-agency projects and on building a better child-centered focus to our partnership work. Second, we committed to sharing common data indicators across our programs to promote a common agenda and maximize the collective impact of our work. I want to share one exciting example of our progress. Over the past year, we've brought together partner agencies like the Departments of Public Health, Social Services, Education, and First Five California through a 5-year Essentials for Childhood grant from the Centers for Disease Control and Prevention to work outside our usual silos to prevent child maltreatment in our state. One of the many tasks they've taken on is making our existing childhood adversity and resilience data more accessible statewide so we can better understand the well-being of California's children. The group has identified 19 key childhood indicators and is collaborating with kidsdata.org to develop county-level data dashboards state and local partners can use. And last month, this group, with many partners, including the Lucille Packard Foundation, publicly released state-level adverse childhood experiences, or ACEs as they're known, in the data for the first time. And finally, we are committed to the Talk, Read, Sing mission. Thanks to the First Five California's public education and outreach campaign, we can now distill decades of early brain research down to just 3 simple words, and you know what they are: talk, read, sing. And everything, positive verbal engagement with young children, changes everything. It's a simple message that works. Talking, reading, and singing with your baby is not just fun, free, and easy to do. It's actually critical for brain growth. I'm excited about the collaborative work going on between First Five California, the Department of Education, and the departments within my agency to create awareness about the benefits of Talk, Read, Sing. I encourage you to use the First Five California website and its toolbox to share Talk, Read, Sing, message with your constituencies. Through all of our collaborative efforts, we can make sure that all children have the foundation and the building blocks they need to succeed from their earliest beginnings. And now I am most honored to introduce this year's special speaker, Dr. Jun-Lei Lee. Dr. Jun-Lei Lee is an associate professor of psychology at St. Vincent College's School of Social Sciences, Communication, and Education, and is the co-director of the Fred Rogers Center for Early Learning and Children's Media, where the mission is to draw a future generation of scholars to the legacy of Fred Rogers. The center looks for and communicates what is simple and deep, and matters most in serving children and their families. The overarching goals of his research and development efforts have been to use research as a way of making sense of important issues and impacting underserved children, and to use development as a way of making use of research findings to positively impact children's lives. Dr. Lee was formerly the principal research scientist at the Fred Rogers Company and was the senior fellow and past director of applied research and evaluation at the Office of Child Development at the University of Pittsburgh. His work focused on the integration of developmental science with training, media, and communication development to improve children's lives in schools, orphanages, and community programs. And as a principal investigator at Carnegie Mellon University, he designed and led research projects to narrow the science achievement gap in underserved urban schools. He is with us today to encourage us to appreciate the deep and simple in early childhood education. Dr. Jun-Lei Lee, welcome to our neighborhood.